Okay, so we're still in the red blood cell disorders. So where anemia was where we had too little of red blood cells, polycythemia is going to be the opposite. So polycythemia is where we have an overabundance of red blood cells. So the way that you are going to determine if your patient has polycythemia, they will have a hemoglobin of greater than 18, but the bigger diagnostic is going to be your hematocrit. So anytime you see a hematocrit of greater than 55%, that is typically indicative that your patient has polycythemia. So again, anemia, we had very thin blood, okay? This blood is going to be very thick, okay? So this one a lot of times is very sluggish as a result, and it even looks that such when you're drawing this blood on a patient. So polycythemia can be two different ways. You can have primary polycythemia, also known as polycythemia vera, and then you can have secondary polycythemia, meaning that it has occurred because of something else. So primary polycythemia, sometimes people misname this. Sometimes I've heard it called a blood cancer, and you'll understand why when we talk about the treatment in a second. It's not a cancer. It just means that they have an overabundance of red blood cells. Secondary polycythemia, most commonly caused by anything that brings on hypoxia. So I have seen people develop secondary polycythemia after they have moved to cold weather climates, for example. So anything that brings on that hypoxia can bring on like a secondary polycythemia. And once you remove whatever has caused the polycythemia, the secondary polycythemia will go away, okay? Whereas primary, it just is some kind of hereditary component. So signs and symptoms of polycythemia, so it's going to be just the opposite of anemia, okay? So where we had hypotension, now with polycythemia, we're going to have hypertension. Anytime you have an increase in blood volume, you're going to have hypertension that goes with it. Patients with polycythemia will also complain of visual changes, headache, vertigo, that spinning, dizziness. They may have tinnitus or that ringing sensation that they hear. They'll have bleeding. They can have chest pain, dyspnea, dark flushed skin, secondary to the excess hemoglobin or hematocrit, and itching. They get very, very itchy skin. So therapeutic interventions for polycythemia. So again, just the opposite of for anemia. So for anemia, we gave them blood. For polycythemia, we take it away. Okay, and what I mean, we do something called therapeutic phlebotomy. So you're going to remove about, I want to say it's like 300 mLs of blood off of the patient. They will do this every few days until the hematocrit level gets to a normal range. So it's called therapeutic phlebotomy. Like I said, they're going to do this every few days until the hematocrit gets to an acceptable range for the patient. Because we're dealing with very thick blood, we want to put this patient on a low dose aspirin because it has that antiplatelet property. And this is why people think that this is called a blood cancer, because the treatment for polycythemia, particularly primary polycythemia, is chemotherapy and radiation. Okay, now remember, what does chemotherapy and radiation do? It attacks the bone marrow, okay, which is where your red blood cells are produced. So chemotherapy and radiation will attack the bone marrow and hopefully stop the overproduction of red blood cells, which is what happens with polycythemia. So again, it's not a cancer, okay, but a lot of people will call it a blood cancer because it is treated with chemotherapy and radiation. Patient education for polycythemia. So this is a lot of teaching that we have to do for this. So you want this patient to drink a minimum of 3 liters of water a day, okay? The hydration is going to help thin out that blood so that we can prevent clumping from happening. We want to avoid any restrictive clothing because, again, we don't want to put any additional pressure on the sites. We want to elevate feet so that we can help promote the return of blood back to the heart. You want to teach the patient to report any signs and symptoms of iron deficiency. So again, anytime we're going through that therapeutic phlebotomy, we are taking blood off of them. And so they are at risk for an iron deficiency. So we want to make sure we teach them signs and symptoms of iron deficiency. You also want to teach the patient signs and symptoms of bleeding. So again, You're going to teach them to check their gums, check their stool, check their urine for any hidden blood. All right, and that will wrap up polycythemia.